questions from our audience that I would love to present to you. And so one of them comes from Mackenzie. And Mackenzie asks, can you speak about MRD testing and what that means for lung cancer?
Yeah, that we was discussing briefly. So minimal residual disease is as I say, when we have an operation, we can have the opportunity to have completely resected a tumor, but we don't know more than with the CT scan when the patient will recur. So we are with an anxiety living every follow-up visit, what is happened, seeing the CT scan. So we are trying to reduce this, reduce the anxiety, first of all, to try to get tools that are able to identify patients that they can have a recurrence. So liquid biopsy is one of them. And we have nowadays several methods that are trials and several data coming, that there are some companies that actually they are on market for some of the options. We are still having validations and required validations, but we will certainly be there very shortly in time to identify these patients and to treat them in the proper time.
Wonderful. And I think you just addressed a question that came in from Harold, which was, is liquid biopsy playing a role in monitoring disease recurrence in lung cancer?
Yeah, sure. We are actually tailoring treatments and checking these patients. And I have several experience in patients that they are monitoring over the time, and we have actually some of the vendors that are proposing this approach to monitoring. Liquid biopsy is a great tool because it's minimally invasive. It's just a blood draw, and we can continue. Not all the patients have the possibility in terms that there are not all shedders. That is something that we need to know, DNA. So in majority of them, we can do it. In some minimal proportion, we cannot do it, but there are also possibilities to follow them.
And our last question from the audience comes from Laura, and she wants to know, are immunotherapy combinations in the metastatic setting expanding to treat earlier stage lung cancer?
Yeah, absolutely. We have actually an FDA approval for using one of the immunotherapeutic drugs in patients after the resection of the disease with some characteristics. But we are there, and actually we are having more and more clinical trials using in early stage. So we will say in the other situation from the early stage, that is the neoadjuvant. And we call that when we are doing a treatment to reduce tumors to be operated later on. So we have also some trials that are going there, but we have an approval already for the adjuvant setting that is after the surgery in some patients.
That's wonderful. You've given us a lot of good news, a lot of hopeful news, Dr. Rolfo. It is time for us to wrap up. I want to thank you again for being here, for sharing your expertise.